All right, good afternoon, everyone. Lovely to see you all, and welcome to today's masterclass about embedding tech in workflow. My name is Rishi, and I'm here with a couple of friends of mine to talk a little bit about our experience and how it's worked for us in the services that we look after, and perhaps give some help and guidance for some of those who are starting their digital journey, or maybe they're in progress on that digital journey. So it'll be really nice to have a chat and share some ideas today. So to give you just an outline of the agenda, I'm going to be speaking to you first a little bit about embedding tech in workflow. And then we have a fantastic speaker, Mike Armstrong, from Havering Care, who's also had some great experience in personally implementing systems across the services that he looks after. But Mike has a wider role in Havering Care, where he supports homes within the authority there. And they have quite a unique setup, quite a unique way of doing things, which I'm sure Mike may touch on a bit later on. And following Mike, we have Tevani, and Tevani is amongst the many things that she does. She's a director of Cambridge Nursing Home, and she as well has got some great experience working with her services and her teams. And she's got first-hand experience of implementing the digital system into her services. And she's about to undertake that in another one of her services as well shortly. So she'll have some lovely things to say. And then Nadra Ahmed, the chairman of the National Care Association, she will also hopefully be making an appearance just to say hello and to talk a little bit of things from her perspective. So we're hoping that she's going to join us at 2:55. And then following on from that, we'll have an opportunity for any questions. If anybody would like to put anything in the chat, I'm more than happy to put that across to any of the speakers, and we can have a chat and see if we can help and support each other. Okay, so without further ado, I'm going to talk a little bit about my personal experience. And so to give you an idea, for any of you that haven't met me or haven't seen me, my name's Rishi Jawa here, and I wear some different hats. And one of the hats that I wear is that I am a director of the Jawa Group. My mum and dad started our care company, and they're both nurses by profession. And I actually grew up in the first care home that they started, which was one of the first care homes in our local authority, and we all grew up in that home. It was called Homelands. So I had the unique experience of growing up in Homelands and with my extended family. And so I've got first-hand experience of the care industry. I really have an understanding of it. I spent my teenage years telling people that I was going to have nothing to do with the care industry, and 15 years ago I came to help my parents at the Jawa Group, and I've been here ever since. So it's been a really exciting journey, and I've learned a lot along the way, and we're really passionate about what we do at the Jawa Group. So we don't use agency staff across our homes, and we really get to know people that we're looking after and build strong connections and relationships. With my other hat as well, one of the things that we looked at is using the recording of our care evidence. And we were using paper when I first came along. This was taking an enormous amount of time. Carers would be sat in the corner of the room, maybe 2 hours after they'd carried out personal care and other activities in the morning. And they would be sitting in the corner of the room, not talking to anyone, not talking to any residents, writing away with a pen and paper. And maybe they weren't always capturing the accuracy of what actually took place in that interaction. Maybe they're just recalling what some generic actions that they might have taken with each of those residents. And then as a consequence, when you look at the notes, when you look at the care evidence, you find that actually the carers have been writing things that don't reflect the quality of service that you're actually providing. Have they recorded that they've had a chat with someone? Have they recorded what mood that they're in? And, you know, are we looking at things like that when we're recording care evidence? So some of these limitations with paper, especially when safeguarding and other things come about, you know, really can hinder what we're trying to do and can obstruct the quality of what we're, you know, the service that we're trying to provide. So I used some of the other systems that were out there, and I found that within our setting, with our you know, group and our team here, they didn't really work for us. There were still many elements that we were having to capture on paper, and this was creating more stress and hard work. So we decided to develop Care Vision primarily for the Java group, and that's how we started. And after CQC and various others came and had a look at it, it was them who encouraged us to take it to market. And now we're supporting care services all over the country, in Scotland and Wales. And it's been a really exciting journey. So I sort of have got the unique position of being an operator and understanding that, but also from the digital side, understanding systems and perhaps putting those two hats together to really have a deeper understanding of what care homes are having to do at the moment, and how we can implement things with reducing stress and still keeping compliance at the same time. The third hat that I have is related to the Must Stay Care International, and it's an organisation that I set up with Joyce Simard, and we're now in 13 countries across the world, and we support people in particular with palliative care, and that's been another amazing experience for me, and it just adds more colour and interest to the work that we do, and everything feeds into each other as well, which is pretty amazing for me. Okay, so that's enough about background and introduction. So let's talk about what we're here to discuss today, which is embedding tech in workflow, and you know, the different ways that we can do it. Everyone talks about going digital and the benefits of it, but is it easy to do in reality? Especially when you've got to worry about your compliance, you know, CQC, local authority coming in to inspect you. You're implementing a new system. We all know they're not going to forgive you when it comes to you not having somebody's care plan up to date, or if you've made errors when you're administering medication. These things are secondary because it's all about the priority of supporting the residents that you're looking after. So I found firsthand that many of my team were resistant to change. Some of the carers that we work with have worked with our organisation for more than 30 years. They've known me since I've been in nappies. So they were very resistive to change. And they thought a big brother type system was going to come and be monitoring them. But actually, you know, it's important that we work with the teams, we bring them along, and we get their buy-in. I think if we don't get the staff and other parties buying into what we're doing in terms of going digital, it's always going to be a struggle. It really has to, you know, be a team effort. The other thing that I would say as well about buy-in and successful implementation with anything, not just digital systems, is it starts from the top. And if the people at the top are not going to be involved, are not going to support and lead that change, it will always be harder. And you know, it's something that we really concentrate and focus on, is engaging the whole team, and that starts from the top. And so it's very important that leaders are present and play a big role in implementation. I think the other thing as well that gets in the way of people using systems is, you know, at the end of the day, if a resident needs a drink, if a resident needs to go to the loo, that is always our priority, that their practical needs, their daily needs. Maybe the recording element of that would always be secondary. But this is where, when you're choosing a system, when you're doing this, you really need to look at a system that's going to work hand in hand with the daily tasks that you have to do, and not going to be an interruption, but going to be a real support and an added strength to what you're doing. In no ways do we create care vision, or the priority is not so that people are just staring at devices all day. It's minimum time interacting with the device, maximum time with the people that they're looking after, and that's what a really good system should be focusing on. Turnover of staff and agency staff, I think as well, this can get in the way of things. If you don't have a consistent staff team, you might have maybe a more technical person that's really doing well with the system. They go on holiday for 2 weeks. You might have to get agency staff in. Everything falls down. This as well needs to be accounted for. You need to have a system for, if you do engage agency staff, how they're going to get trained, how they're going to use the system. What's your plan when it comes to new staff, how they're inducted, etc. An absence of a clear plan, again, in any field that we go through, is always going to make things harder. And with implementation, it's no different. And we really need to plan clearly. You need to plan your stages, your phases, how you're going to phase out maybe some of that paper recording, which are the elements to focus on the digital system initially. And these sorts of things have to be planned and organized in that way. And the other thing is lack of appropriate infrastructure to support systems and not having contingencies in place. I think it's all well and good. We talk about going digital and the benefits of that, the time-saving benefits, the benefits for the residents. But as well, we're at the mercy of some fundamentals here, which are, do we have internet connection? Have we got power? If we lose some of these elements, everything's going to fall down. What is our backup plan? And in those instances when things do go down, when we have Storm Eunice or Storm Dudley, flooding, as my friend Katie was telling me about, where she is in Shropshire, these things will happen. They will interrupt us. But what's the plan to continue the service? Because CQC and other bodies that are coming to look in don't care about those things. These elements are things for you to manage when you're looking after people. So what's your plan? So having this in place is really important. Okay, so there's some of the barriers to adoption. The next thing we're going to go on is to talk about choosing a care management system. So what are the benefits of going digital? So we can avoid duplication, inaccurate records at the point of care. So this is what I was talking about when carers are sitting in the corner of the room, writing away with the pen and paper. They're actually not spending time connecting with the residents, not finding out how they're doing. Some of those most precious moments of our care is when we're having a chat with someone, when we're connecting with them in some way. And again, you need to make sure that whatever recording system you're using, that you allow sufficient time for that priority. All right, so that always has to be there. The nice way is that if the carers are recording at the point of care and it's making it easier for their care recording, they're avoiding duplication, we can then take that data and do something useful with it. We can analyze trends when it comes to accidents and incidents. We can try and prevent something similar happening. We can also identify within the team who's taking the load of the care evidence, who's doing most of the work. So these types of things are really effective and useful when it comes to using digital systems, because we've got the criteria. My son, who's an expert in quite a few things, but in particular football, and he knows all the stats of all the Premier League players, how many minutes, how many assists, how many whatever other statistics. But how often do we use this statistical analysis when it comes to carers, their supervision, their improvement plans? Again, with digital systems, the right digital system, you can get that type of analysis. All right, selecting from the assured suppliers list for digital social care. The NHSX have gone through a massive project of engaging providers, engaging IT and digital support systems and looking at criteria. And they've done a great piece of work to try and bring things together so that through a rigorous structure and criteria, companies have had to go through this process. And believe me, CareVision had to do this. It is rigorous. And, in order to do that, you're actually saying, actually, CareVision, it meets every single area that NHS are asking about here. We are able to do this. We are able for the families to log in. We are able to do email. We are able to, to train people in a certain way. We are able to protect the data as well. So this type of criteria has been a fantastic move forward, because it separates in terms of people that have achieved and met that quality mark and those people that haven't. And we have experiences directly from companies, from people who are moving across from systems that aren't on NHSX assured suppliers list, and some of the challenges and difficulties that they've had as a result, because they're not at the sort of working under the same level of criteria and regulation as the companies that are accredited with NHSX. So looking through the dynamic purchasing system, looking through the assured suppliers list is an excellent place to start. And I honestly think that for the future, this will be the one place that all the quality providers will be looking to purchase their systems. One of the things we talked about is confidence in data if ever you leave, and sort of maintaining that through NHSX. That's another thing that's looked after for you. Engaging the workforce in the decision and listen to their views to encourage the buy-in. At the stage when you're choosing that system, why not have a representation of each of your departments within the service? So you might have some carers there, maybe some housekeepers, maybe you've got the nurses as well to be involved. You're going to have people in the admin office, and then you're going to get the perspectives and angles for each person in each of their roles and how that feeds in to making that decision. And then everyone feels part of it. And even if you don't choose the system that maybe they voted for, at least people were involved in that process, and then the implementation is going to go smoother. Nominating digital champions to support internal training and have a lead point of contact. Again, this is a vital thing that at CareVision we do all the time. We try and identify champions. We try and praise people when they've done really well, and give them roles that maybe this carer didn't have a senior role within the organization, but they're really technical when it comes to using apps. So you can be a CareVision champion, or you can be a digital champion for us. So it's been a really nice way to again help people with their internal learning. Choosing a user-friendly system that's is user-friendly, having a system that's easy to catch on to is very important. Otherwise, you're not going to get that buy-in from the team. And then the other thing is, it's important to as well communicate with the families and the service users that you're supporting, so that they understand that if you are going on to using a system, if you are implementing, that this is part of your work for getting better quality care evidence, and you're not just looking at phones and getting on with, looking at Facebook and whatever else they might think you'll be doing. Involve them in that process as well, so that you communicate well clearly with the families. Okay. So once we have chosen that system and we found the right system for us as well, we want to transform the carer and service user experience, okay? And we want to make sure that people feel the benefit. So some of my personal experiences is that some of the success stories is the hardest people to win over, like those carers that have been in the industry for more than 30 years that say that they're not tech savvy, is winning over people like that you've done something well when people haven't had that confidence, but through using the system, it's given them another confidence. It's given them that boost that they needed. And in fact, now that their stats are being recorded of how many daily notes, how many care plans they're writing, they want to show that off. Every time they do something good, they want to record it. So it changes that culture. When you change that culture, you can revolutionize the way you deliver care. You can take it to the next level now, because you're not going to be burdened with writing notes. You're not going to have the worries of, did I miss this or did I miss that? Because my system's going to prompt me when somebody needs medication. My system's going to prompt me when somebody needs to be turned. So again, these potential safeguardings that could happen and we could come across The risk of these are reduced, dramatically when you engage the right digital system. Okay. Increase productivity and efficiency. This is another big part of what we do. I think people are more productive and effective when they're using digital systems. They're spending less time recording their care evidence, more time connecting with residents. We already talked about this a little bit, reducing errors to keep people safe. When the owners, the directors, maybe some of the people that are on this call, when we lay our head on our pillows at night, we want to know that everything's all right and we've done everything we can to minimize the risk of things going wrong or anybody getting hurt or something, something happening the wrong way. So engaging these systems, giving people good training, good implementation, it gives you that assurance as well. And then whilst you're going on, I think it's really important that your care management system providers support you along that journey to make consistent improvements. You don't just want to get to one place and stay there. You always need to have a goal set so that you're constantly on a program of improvement. Okay, and that goes hand in hand with continuing the digital journey. And now that I've got confident in writing my care plans on Care Vision, now how am I going to engage people, the visitors coming into the building? If you're still signing in with paper, I can see personal details of the previous visitor, and that's not GDPR compliant. So maybe now we're at a stage ready to go to the visitor tablet where we can record visitors on that. Now we're at a stage where we're ready to move to EMAR so we can reduce the errors, etc. So working in a modular way is really nice and effective. Okay, planning your digital roadmap. When you're choosing that system as well, this goes hand in hand with it. Think about the spectrum of the service that you deliver. It's not just one dimensional in care. It's not just about care. It's not just about medication. How do you manage your rota and payroll? Your nurse call system, when I ping a nurse call in Mary's room, is it going to ring on one of my devices? Is it just going to ring in the corridors on the panels? Have we got that option of integration down the road? Event reporting and analysis. There's some systems out there that have dedicated their system to just doing event reporting. That's all well and good, but do I have to feed that in twice, where I've got to feed everything into the care management system and then everything again into the event reporting system just to get it to give me some output? Or does my care management system have event reporting within it? So again, this type of flow is really important to consider. HR needs, training matrix. Do you employ people on work permits? Have you got their references? Have you done DBS? Are you reminded when it needs renewal? That can all be done through HR. So again, think of the wider picture. Is this system going to embrace all my future needs? Is it going to be fit for the next 10, 20 years? Or am I going to have to chop and change, which is going to create extra difficulty, maybe create a burden on budgets, etc. The other thing as well, which my friend Tay actually, talked to me about, and she highlighted to me more as well, is that when we're looking at integrating with other systems, is it an actual integration that's offered through the system, or is it just two apps sitting side by side? So if I have planned on my digital roadmap to go to EMAR with a certain company, but that EMAR provision, is it actually within that company, or is it just a third party that's going to be an app sitting side by side? I'm still going to have to enter a resident twice when they join, and I'm still going to have to take them away twice when they leave. So look out for those type of integrations and really quiz and investigate companies to find out what's the quality of their integration and what work output does that mean for my team. Try to get it right the first time when you're making that decision, involving the staff team, all of those things. But again, as has happened many times with many of my clients that have started in one way, if you don't get it right, don't be afraid to change. And there's no time better to change than, as soon as you realize that you need to. So don't wait, don't hold off that change and stick with something that's not satisfying, that's not meeting your needs. If you know that it needs to be changed, then do it. Digital systems, the way that we're recording, the way that CQC are looking at things for the future, this is how Everything is going in terms of even inspection during pandemic, maybe sending CQC notifications in future. How's my hospital transfer information going to go to the hospital? How's the information going to come back to me when one of my residents comes back from hospital? This is all going to be done through digital social care. So starting that journey and planning it now is a really good idea. Okay. Engaging the workforce through implementation. Okay. We've talked about this as well, winning over the team and having their buy-in, like I said, even from the demo stage, even from the selection stage, the tendering stage, involve them, get them involved, have their views, have their buy-in. Another thing is tying in your company values. So mine within our organization might be compassion, might be bravery. These are values that we can tie in to our approach when we're looking at implementation and actually saying that, you know, this is part of who we are. And even though it's a challenge, we're all going to be doing this together. So again, that's another great way to engage the workforce, is bring them back to why we're here. What are the company values? I think another great benefit, you know, that we've talked about and we talk about is the benefit to the planet. I think for too long we've neglected, you know, the needs of the planet, the needs of the environment. Younger people, younger generations are now bringing this into the mainstream, and I think we're all as a society becoming far more aware of this. So why not focus on that as a big plus? We're reducing the carbon footprint by going paperless. You know, that's a really big positive. So even though there might be some struggles, some moans and groans, we know that it's for the ultimate benefit of going to that digital system, and the benefit that it's going to have for the environment. That's another great thing to highlight. Getting more time to interact with residents and not care evidence. Again, we've talked about that on the system. You want to have time to have positive connections. What are the fears? You know, I think it's important as well to talk realistically and openly to the staff team about the fears. Let them voice them. Let them say that they think it's like Big Brother. Let them say that they think, what if I make a mistake and then it's going to be saved and then I can't do anything about it? Because through those discussions, you will be able to offer the solutions that will reassure them. And then they've had a chat about it, they've got it out, and when they come to using the system, they're going to be a lot more in a place to better engage with that. And then another thing, the final thing on this slide, is further support for those that are unconfident with tech. Every implementation that Care Vision has done, every care home or care service up and down the country, you're going to have people that are stronger with tech and people that struggle with tech. And the stronger people, you really never have to worry about, because they're going to find things in their own way. It's important that we focus on those people that are less confident so that we can win them round, and we can come up with some sort of plan as to how that person can interact with the system in a way that's not going to stress them out and still make them feel involved. So those were some points there about engaging the workforce, embedding tech in workflow. So, you know, the priority must always be the residents' needs. Whatever happens, whatever system you're doing, that has to come first. And I don't think I have to tell many people on that call, because obviously that will always be the priority when your residents need something. But as well, with leaders being involved in this implementation process, if we're involved in observing that, oh, right, somebody had to give Mary a drink to meet her fluid target, you know, and we're involved in that. But at the same time, whilst that was happening, an accident happened on the other side of the room. So which one do we record first in the practical scenario? How do we manage that? So again, leaders, managers, seniors being involved in this process and guiding people through when they get to those practical stumbling blocks is really important. Technology should be supportive, not interruptive to the way you want to work. How do you phase out paper while you're maintaining compliance and keeping stress levels down? Maybe you already have a system in place, but the implementation has not been successful. I think it's important to pick out what are the vital things. So whenever we're implementing Care Vision, we always focus on the carers starting to write daily notes using our interactions. So we've got a really great system of writing daily notes where you can dictate even in other languages. You can use icons that generate text for you, which is really a great way of engaging people. But getting the carers started on that, it actually takes them off paper straight away, because then they realize that by using the app, I don't have to write the same thing. I don't have to continuously be writing records and spend that time. This is going to save me time. So they do buy into it in that way. And then when you just introduce one element, for example, daily notes, maybe they're not going to do their accident and incident form straight away. Maybe they're still going to maintain that on paper. Again, you need to see what phasing, what line of work works well for you, because you need to maintain your compliance. You need to implement the digital system, but at the same time, you need to keep the stress levels of everyone who's already stressed. It's a stressed environment. You need to keep them as low as possible. Having a go live date and implementation plan and leadership from the top is essential. I've said that a few times today. Having this plan is very, very important. Introduce elements at a pace that the team can manage while maintaining compliance. Nominating tech champions is another great way to embed tech in the workflow. And then we need consistent support and continued training throughout that process to make sure that we maintain that and we keep people going. I also think, I've done training for Care Vision in the care home environment, and we've been there, and the nurse call has been pinging continuously in one of the services. And not only is it distracting, but people will always have, that human nature to be like, oh, right, that bell's ringing, I need to ring, or somebody needs help, I'm going to do it. It's important that you mix that training scenario, and that some of it is done practically while you're at work, but as well that you do give people the opportunity when they're off work, when they're in a space where they're not going to be interrupted, to learn and to engage with the system in that way. Because when all the distractions are taken away, we learn much better, we focus much better. So, those are a few little points that I would make in terms of, training as well. Right, so other elements to plan for a smooth transition and embedding tech. Broadband provision is another big one. If you're using a digital system, what's your broadband like? Using domestic broadband is not always the best idea, because you'll breach the terms and conditions if you're actually a business using domestic broadband. If you've got broadband, what's your backup if things go wrong? For example, in my homes, we have 2 broadband lines and we have a failover line. We also have a dongle, a 5G dongle, that if those 2 lines go down, we can use the dongle for connection as well when we've got such a reliance on electronic system. So that's another part of it, is planning the backups, the contingencies. Even though some systems have offline modes, it's to ensure reliable recording of care evidence, Wi-Fi must be considered. It's really important to have good Wi-Fi infrastructure. Access points should be set up around the home. Even though systems have offline modes, it's important to put a good budget aside for Wi-Fi. Getting support for Wi-Fi infrastructure, a company that's going to support that if things go down, if things go wrong. It's really important that you've got that in place when there's that reliance on digital technology. Managing devices and creating a process with charging and spare devices. I don't think this is spoken about enough, but care home owners, directors and companies, they're making big investments in hardware, handsets, tablets, etc. What's the process for keeping these safe, keeping these charged, keeping them accounted for? Is there something within the system that's going to help me to do that? These are all questions to ask, but these are all things to consider as well to help that smooth transition. Connection contingencies and processes. Right, having a reliance on technology, I've talked a little bit about this already. Having a backup line. Lease line is another option where you have a dedicated line coming into. It's a lot more expensive, but at least you've got the confidence that you've got that in place. I think it's important as well to consider what happens when you lose power and electricity. It's come up in CQC inspections for my own services. They do try and catch you out. What's your backup plan? What's your business continuity plan? And then if you're engaging a digital system, you need to bring that as part of it. Other things as well is, how do we manage essential communication? So when a resident goes into hospital, how do we give that relevant information? Are the paramedics going to raise a safeguarding on me because they're going to say that my staff haven't given them information? So does the hospital transfer form that I'm giving allow the paramedic to sign and get involved? So again, give us another layer of evidence that we have passed that information on. If the internet goes down, if the power goes down, how are we going to generate those hospital forms from the system? What's their plan in relation to that? It's important that you ask them that. Do they have an offline mode? Is there a backup sent elsewhere that can be accessed, etc.? And this comes to email as well. Again, internet power goes, you're relying on a digital system. How am I going to give my medication? What is your backup plan if those things happen? So having these contingencies and processes is, again, another essential when it comes to embedding tech in workflow as well. And my final slide is again getting back to that reality of cost. We're in a situation where costs are rising, wages are rising, all the things that we have to provide within the care services, utilities, food, all these commodities are rising. How we manage our budgets in this economy at the moment. And I think if a budget is not set aside for digital, for Wi-Fi infrastructure, for broadband provision, sad to say, but I think the company may be left behind, because this is the way that the world is moving. This is the way that the care world is moving. And it's very important that each organization allows budgeting for these digital elements. Now, we know that that's not always easy for certain companies. There are a lot of funding available. Katie and Claire, who are on this call, have lots of information about that. And this is part of the NHSX promotion and masterclasses that they're doing. They're trying to encourage people and say that there is funding out there available through your commissioning groups. There will be other funding available as well for care services. So please keep in touch with your local authorities and your CCGs to find out more information in your associations. But there's lots of help out there. For example, things like broadband. It doesn't help if you're living in a metropolis or in a city environment, but those people in rural settings, there is the gigabit voucher scheme where you can get vouchers of up to 1,500 to 3,500 for businesses to help cover the costs of broadband and bring faster and better quality broadband to settings that don't have that infrastructure at this moment. So there are a lot of things available out there. So keep doing your research, keep connected with other people and find out what's going on, because you'll find that there will be help out there for you. So all in all, I've covered a number of things there. And we've gone over a number of things. Please, if anyone's got any questions, please feel free to put them in the chat. We'll be happy to pick them up in the Q&A section. And I hope that that's been useful in what I've been able to put across. And now coming up, I have the pleasure to introduce Mike Armstrong, the Managing Director of Havering Care Homes. And without further ado, I'll hand over to Mike. Mike.
Thanks ever so much for that. It was a really interesting presentation, and actually it looks like we might have shared one another's slides because there's many crossovers. I'm Mike Armstrong, Managing Director of Havering Care Homes, but also I'm the Chairman of the Havering Care Association and Joint Chair of Care Providers Voice in North East London. And we've done some really interesting work already, working across North East London, looking at the implementation of DSPT and working with other providers and with CCGs, etc., to get as many providers on board with completing the DSPT toolkit, which then enables them to access a whole range of online digital facilities. In Havering Care Association, we did some work on the implementation of remote monitoring across the borough, and that certainly saw in my care homes number of hospital admissions unnecessarily going in reduced by about 40%. So, a great piece of work where the systems come together across an area to work to make lives better for our residents. So if I can just move on to the next slide, and I'd like to introduce one of my fabulous team at Upminster Nursing Home. Her name's Tina. Tina is a dyslexic. She's worked for me for about 7 years now, and used to really struggle and hate writing the care notes. And she herself would say that those notes often were quite poor and not necessarily that detailed. And when we went to her and started talking to about the idea of moving towards a digital care planning and note system, I think it would be fair to say that she was quite nervous and wasn't entirely sold on the idea. Now, one of the interesting things with Tina is she is really keen on making things better for residents. And if you can sit down and explain to her and engage with her about why something potentially is in someone's interest, both them as staff, but also more importantly, the residents, then she's really keen to give it a go. And so it's people like her that we seek to work with when we're implementing digital systems early on. And if we move to the next slide, it sort of suggests why that's the case. So when you're looking to make change, there's about 20% of the workforce who are early adopters. And Tina certainly falls under this group. They're interested in change, they're interested in seeing things improve, and they're more open-minded perhaps than many. There's about 60% of the workforce where if you support them, give them information, additional training, and they listen to the peer pressure that's going on within the home, they too will come on board. From experience, there'll be about 20% of certainly my workforce that were really anti the change, weren't really keen on moving to digital, and spoke about all the reasons why that might not necessarily work and how they'd tried different things in the past, so therefore there's no need to try it again. So when it comes to making the change, we try to identify people like Tina. So there was 3 or 4 of them within the home who we involved in the decision making, a point made earlier. So we got them to have a look at the systems, ask the questions, challenge what we were doing, why we were doing it. And then we took that on board when we were looking at going live. And then when you are making the case to the workforce, you already have an idea about how they feel, because somebody like Tina would influence everything that the staff thought on the floor. She was one of those key decision makers and key influencers at a ground level, not necessarily what you would deem as an organizational level. We tried to then be clear about what the benefits were to them and to us, because ultimately the system is about the whole team and how we move forward together and how we keep the resident at the heart of the decision making. After we'd gone live with the system, it was at that point we reinforced the successes. So talking about the care notes earlier, we really focused on how many notes they were producing each day initially. So not worrying too much about the quality of them at the start, but just getting them to ensure they were recording everything they were doing. We would then go back and say, okay, that looks really good now. You've got a huge amount of notes there. Let's raise the quality of those notes. So rather than them recording that they'd had lunch, they then go into the system and they will record what they had for lunch and then what percentage of stuff they had eaten. So we would use the system just to take it in bite-sized pieces for them. So moving forward to the next slide. It was spoke about earlier, you need to be really clear as an organisation. And I think we were clear with ourselves about what the priorities were, why we were doing it. And one of the things was about going on this journey to move away from paper, about the environment, but also about things getting misplaced, being unsecure, so on and so forth. And we just didn't see that paper was really the answer. So this was something I worked on with Northeast London STP, but it was really true for our care home as well. So making sure that we had all the bits in place to build up towards digital solutions. Moving forward onto the next slide. We then made the case about why we were making those changes. So going back again to saying to the staff, this is about releasing time for you. When we introduce digital solutions, we're looking at, is it going to improve the quality of information? Is it going to improve the quality of care? And is it going to save people time so that they can then reinvest that into the residents? So that was one of the key parts of looking to move towards a digital care system. Is the information going to better support the care? So are we going to understand much more about what that individual is doing? Are we going to understand more about the sorts of things that residents enjoy, that particular resident enjoys? Are they drinking enough? Are they eating enough? And where they're not, are we taking the appropriate actions? And is there a clear pattern to show why there's some of the challenges with somebody's care that there is? We wanted to use it also for better information for the management to support the team. And the best example is safeguardings. You know, often people used to come forward with a safeguarding matter. You'd never have quite enough information. You wouldn't necessarily have the full stories. You'd have to go back and do much more detailed investigations. Through the digital care planning system, what we found was that actually the daily notes were much more detailed. There was much more evidence. There was time commitments that were made on the system and then recorded of when actually care took place. And by having all that information, it was much easier to tie together what had actually happened with an individual. And therefore that supported the case, particularly around things like safeguardings. What we've started to see in Havering, probably much later than most of London, is a more diverse workforce. I talked about in the dyslexia within the workforce, which is quite high. But obviously what we're now seeing out on the periphery of North East London is a much more diverse workforce, where English isn't necessarily the first language, and actually having a system where you can voice record, where it can identify very quickly when you're getting something, when you're recording something incorrectly. We found that all this really helped in building staff confidence. And going back to that story about Tina, one of the things she was really nervous about with digital was her dyslexia. But all of a sudden, she found out she could voice record, that as long as she could get the first part of a word spelled correctly, that actually it would auto-correct. And she found that actually she could press icons. And all this actually made the recording much better. And in fact, she came on to be one of the key trainers within the care home, training up all of our new staff as they came in. So she grew hugely in confidence by moving to a digital system. We wanted to reduce duplication. When you're using pieces of paper, you end up writing things down so many times. And the last thing was about better management control. The more information you've got and ensuring it's displayed in a way which is useful and easy to understand is massively important. And you get that from a digital system, we found. So moving on to the next slide. So our approach to implementation, well, I've already spoken a little bit about it, taking the likes of Tina to join the, if you like, the leadership team, to help those who were struggling with the implementation, building their confidence, but also building the confidence of those who were struggling, because they can go and work with their peer group. And it's amazing, when you're working with your peer group, you're so much more willing to give time than perhaps in other circumstances, because they're all looking out for each other. They've all got each other's back. We broke it down into bite-sized pieces so they didn't feel overwhelmed. So when we first talked about introducing a system with care notes and in care planning, people's eyes were popping out of their head with the thought of all the work that would be needed. So what we did was we focused on the daily notes first, we built that up, and then what we started to do was to build up new care plans of new residents coming in. And when we were confident that we were doing that properly and we were happy with it, we then just put some additional resource in to bring the remainder of the residents onto the system. So we broke it down in a way where people didn't feel that they didn't have that time and space to learn what they were doing. For us, we're a small care provider. We have a couple of nursing homes. So we were really keen to work with a provider who would let us influence their product. We think that that's been a huge benefit for them as well as us. They've got a better product at the end because it works better. And for us, it was great for our workforce because staff felt not only could they turn around and say, well, this doesn't quite work right, but then they could actually see coming back that the changes were taking place on the system, showing that we were listening to them and they had some power and control. And as we all know, one of the most frightening things about change is that thought of loss of control. And actually, it gave them a hand back on that control, which made a huge difference. Moving to the next slide. So our learnings, what did we take from it? I think for me, one of the main things when we introduced a care planning system was actually I didn't allow enough resources for the setup. We brought in the organisation to do some training with the staff, but and we ran a number of additional sessions as new employees were coming. But the thing we didn't probably put enough time and money into was the transferring of the new files and making sure we had some extra resourcing to make that happen quickly. So it was probably slower than we would have liked on the implementation. We didn't give enough consideration to the infrastructure being resilient. So when we introduced the system, it was fine. And when we introduced remote monitoring, it was fine. But as we kept adding in new apps, new opportunities for digital solutions, what we found was we got ahead of the infrastructure. And eventually, when we had 50 odd devices, including the residents on the system, it keeled over. And in fact, we did something very similar to that's been spoke about before. We put in two internet lines, and then we put in 4G as well, so that depending on if there was issues with the internet, we were able to go across to 4G. And the last thing is, I probably didn't give enough thought and credence to the nurses. And what I mean by that was actually they were the ones who were least likely to adopt the technology. Our workforce, our carers, often are a bit younger than our nurses, were actually quite au fait with the technology because it was pretty similar to their phones. Their fear was very quickly taken away. For the nurses, it was quite a different way of operating, and they've spent 30 years plus in many cases operating with a pen and paper, and were really unkeen to move away from it. And we found introducing things like the online wound care management elements much slower to introduce. So we've had to go back and spend more time with the nurses and actually go back to some quite basic digital training, because the reality was most of their concern was around a fear of the system. And if there's one thing that I would say to take away and to say to your staff as you're implementing it, is actually don't be afraid of failure, because none of it goes 100% well. There's lessons to learn from everything. But actually, if you're on that journey together and you're working together, then you will make it a success, maybe not in your initial time frame, but it will be a success. So thank you very much for listening to me.
Brilliant. Thank you, Mike. That was really useful. There was a lot of crossover there, but in a really positive way, I think. Lots of the themes tied in. I think that example of Tina was fantastic as well, because I think maybe we've all got a Tina or some Tinas in our organizations that need that extra bit of care. But what a great outcome that she's now a champion and one of the trainers, within the team. I think that's lovely. I think what Mike has said as well about nurses is, again, something to not be underestimated. Nurses, they do have a fear as well of their own pins, their own professional body, and sort of maintaining that. So that as well does come into it, and that's something that we've experienced as well. So I think there's some very useful points and some really nice slides in there, Mike. So thank you very much for that. So our next speaker is Tevani, and Tevani is one of the hats that she wears is she's the director of Cambridge Nursing Home, amongst many other things. And now Tay's going to speak a little bit about her personal experience. And thank you very much. I'm going to hand over to you, Tay.
Thank you very much, Richie. So I'm Tevani Nagendran. I'm the Managing Director at Rochemont Care. I'm in a unique position actually for this conversation, in that Cambridge Nursing Home, one of our services, took on actually Care Vision, as it happens, 3 years ago. And another one of our services, as Rishi mentioned earlier, we will be launching hopefully in the next few weeks digital care planning system, so Care Vision again. So we are internally looking at lessons learned, what can we do this time round, and it's a great opportunity for me to share our experience with everyone here, and also take quite a realistic approach to expectations. Next slide, please. So I have seen Mike's slide pack. So looking in particular at Mike's slide, where he said about the 20%, the 60%, and again, the 20%. What we are looking at is how do we increase that 60% in the middle and the 20% of people where we've said they're never really going to get it. What do we actually do about that? And how important is it to do something about that? And then what happens if we don't do anything about that? Next slide, please. So who are these 20%? So what's key to really understand is it's not out of laziness. It's not because people can't be bothered to engage with the system. I actually got these reasons by asking my team, and I went and spoke to the people who initially really did not want to go digital, did not see the benefit of it, were really worried about the system, and a lot of the reasons here have already been covered. So they thought it would be too overwhelming, scared of making an error, especially people who don't use digital systems, don't necessarily use Microsoft packages in particular. So Microsoft, obviously you can delete, and you just tend to be a little bit more tech savvy. But if you're, posting, for example, and tend to use social media, once you post something, that's there and out there for the whole wider world to see. So it's a slightly different mentality. Also, not knowing who to ask for help. So Mike mentioned previously as well that it's great when you have a digital provider who's open to questions, open to you asking for help. If we've got a great contact who over at Care Vision, Oleg, who we just message anytime there's any little issues, whether or not he likes it or not, but he'll always get back to us very quickly, and it's very reassuring for the team as well to know, sometimes actually if the system isn't working or isn't able to do it in a particular way, that it's not them, and that then gives them the confidence to be able to continue to use the system, and that empowers them as well. Not understanding the terminology. So that's around everyone's mind works in a different way, and how the simple kind of way of explaining it is our shared drive that we have at work. It's got a whole set of folders whereby people, save documents into the different folders. When I'm looking for a particular file, my mind will make me search in a particular way through the folders, but that's not necessarily how somebody else has searched through the way. What's key is that you explain to people how to search for things. So, for example, through daily notes, you can input in and put in the search terms, and then the relevant entries then will all come up. So then that again then provides that level of reassurance for the team that if they're ever stuck, this is what they need to do. Appointing digital champions, appointing digital champions who work at different shifts. So there's no point, for example, having your only digital champion being an admin person who's Monday to Friday, 9 to 5, because you've got people who work nights, people who work weekends, for example. What happens if there's an issue, especially in the early stages? Where do people go when they need support? I've written the no scribble function. So depending on how you were trained, where you were trained, your work experience, you may be used to scribbling on top of notes, or on your handover books, for example, scribbling or ticking back to say that you've completed tasks, post-it notes, all of that kind of process that people worry they won't be able to continue to do. So digital systems are able to accommodate for that to a certain extent, but then they can't for everything, and that's okay. So that's another thing that we're going to, or I'm going to continue with. It's all okay. Whatever you do, it's okay. Innovation, it takes time. It takes a lot of trial and error, and it's okay. Failure is okay. So, I mean, Mike said, what was it? Don't be afraid of failure. It's a journey together. And that's really, really key. So we are all going on this together, and the leadership and the management around implementing this system is really what drives it forward. And next slide, please. So innovation doesn't happen in a vacuum. Could you press the next bit? So there's lots and lots of different stakeholders. So it's key to know exactly who is involved in who's going to be accessing the system that you're going to be putting in. So the care records, the data input, the majority will be your care team. But then it'll also be if you've got any students visiting, if you've got any visitors, they may be accessing, for example, your visitors book, or they may want to access and see records of their mum, see how she's been doing, or when you get a phone call and someone says, oh, how's mum doing? You can quickly go on and need to access the information that you need. The mental health team, for example, may need to see lots of different information. Safeguarding, that's the most common team that we need to provide information for. So being able to provide all the information in a clear, concise way, especially when you're transitioning, is very important. So I'll talk about in a second, but around planning, but mapping all of these different stakeholders and also their abilities, their expected level of interaction with your care records, what you want to be presenting, because sometimes you won't want to be presenting everything, as we know. So ensuring that you're familiar with the tools to present what is appropriate and what's not. So I've put this slide in to have a look actually at the technology innovation slide cycle. So it is a continual process. It's not just that you decide, right, I'm going to implement digital care records and that's it. And this is actually the mistake that I made first time round, that I will admit to now, is I was too bullish. So I said, right, this is going to be the launch date. We're just going to go for it. And we launched too many modules all at the same time, and it was overwhelming. And we didn't pilot it enough. So this first part of the cycle, so where we talk about the feasibility testing and pilot projects, what I've since learned is around testing. So when you are actually testing people's ability to type, do people understand the QWERTY keyboard, for example? That's something that takes a little bit of time to get used to if you're not used to it. If you don't have a smartphone, some of our team at the time, 3 years ago anyway, didn't have smartphones. So weren't familiar with that. you can pilot as well. So if you launch different parts to your digital care records journey, you can you could have, for example, module 1 being launched in month 1, module 2 month 6, module 3 at the 1 year mark, for example, and then that cycle just continues and goes round and round and round. And every time you do it, you should be getting better at understanding and learning from the process. And it's important as well to work with the other stakeholders in that cycle. So what happens to that 20% though? So if that 20% don't engage with it and aren't able to input data, aren't able to use the system, it's essentially like a puzzle where you've got, let's say, 4 different players, each sitting in one of the corners. So this guy here in the on my screen, it's on the bottom left, and you can see what's happening here, but you sort of want to know what's happening up in the top right hand corner, and that's someone who isn't really engaging with the process. So you don't get that whole picture, but that then ultimately leads to ineffective record keeping. So it doesn't matter that this guy here down in the bottom left is doing everything 100% if the rest of the team aren't able to do it. You'll end up with staff then feeling isolated and tension within the team. So you need to, again, ensure that it is a continual process and that you are continually reaching out to your team and that you're continually trying to see what works for the team and trying to preempt as much as possible the issues and essentially risk assess. Next slide, please. So you can break it down. So Mike's covered a lot of this. So looking at your organisation values and culture, you really need strong leadership to be able to steer innovation, and you need management to support. So accessible management who are around, who can answer questions, who are able to work with all of the digital champions that you have. People who really understand the system. So leadership needs to understand the system and, sit down and actually spend time knowing where things are, so that if they're asked questions, they're able to navigate the rest of the team to that. There's no point having someone say, yes, we're all going to go digital, and they don't know how to do it themselves, as it just doesn't show that it is an accessible system. Prioritize what's needed for your service. So what is it that you actually want digital systems to answer? What is the problem? Why is it that you are going to go digital? Plan. So if, for example, you're trying to do it over the summer holidays, this is something else that we did. We launched just before the summer holidays, and then we just periodically had people who went off on annual leave. It's very difficult then to have that continuity, because you'd have somebody who had a week, for example, getting used to the new system and then went off for 3 weeks, then came back and then had to be retrained, so then somebody else would go off. So try to plan a time when everyone is around, where people can support one another, organise the information that needs to be inputted, organise what information will be inputted, so that throughout the whole process you are able to access all the information that you need, whether it be paper or digital, and be transparent. So tell your contracts manager, for example, tell your safeguarding teams, tell your quality assurance person when you speak to them, whoever it may be, that you are thinking about implementing this system on this particular date. You may have a bit of a tricky period for, let's say, 3 to 6 months, but you'll be using a backup of paper, for example, for that transition period. Whatever it is that you decide to do, tell other people about it. Don't let that become almost another burden or a worry on your shoulders that, oh, what happens if I, for example, get inspected in that initial transition period? That's completely fine. It's all okay, as long as you are aware of the different status of your journey. Next slide, please. Okay, so this is slightly controversial, which is around hybrid systems. So what we've found is some things are great digital, but some things just aren't. So knowing our team means that there are just particular ways of working. So we've got a team of 50 members of staff. Our nurses, we've got 8 nurses, and their particular, and they've been with us for, you know, like 15 years. We don't take any agency staff. So it's the same people using the same system. So whatever system I decide it won't work unless I have buy-in from them. So it's about ensuring that whatever we do it together. We make that decision together. The team are part of that decision-making process. And we have decided that a hybrid system is the way forward for us, and other providers that I speak to also have hybrid systems. But it's it's important that you know why you're having a hybrid system. So why is it that you're using paper? How long is it that you're going to use paper for? What particular purpose? So for example, we had a resident who was at risk of self-harm, couldn't have anything around her. She was bedbound, so she was in bed, but couldn't have water near her. So the team were popping in, and we had them popping in every half an hour, because she'd also would need a lot of encouraging to take any kind of fluids. So the team would be popping in every half an hour. I wanted to ensure that it was happening every half an hour, because she was obviously at risk of dehydration and UTIs, etc., etc. So we had in place a paper fluid chart to be able to visually just quickly check to make sure that somebody had popped in to offer her a drink and to make sure that she was okay. So there is a way of doing that on your digital systems. You can set up care routines to alert people to it. When you go onto like fluid charts, you can digitally see all of that. You can input in what their target fluid amount is and how much they've actually taken that for that day. But because she was at a very high risk of UTIs in particular, and because of wound healing, I thought it was important for her to have a physical chart that we could just at a glance see. So the priority always needs to be to ensure your residents' safety and their needs are being met, knowing your residents, knowing your service, knowing your team, and why it's being used. And that also then has to be communicated to your team. So ensuring that everybody knows, just for this particular resident, that it is paper. What you don't want to have happening is people aren't sure what is digital, what is paper, what is where, who's doing what, because then that's when you get into problems. So it goes back again to the planning and organising and ensuring that you are aware of exactly the whole picture and holistically what is happening within the service. And whatever you decide to do as a team, that's okay. So for me, hybrid systems, that's okay. We all do the best that we can. We all have very busy services that have lots and lots of other things that are happening. Digital is there to empower your team, to promote the quality that of service that's being delivered to residents, and ultimately to improve health outcomes for them. I don't know if anybody read in the Caring Times I was reading earlier that Vic Rayner had quite an interesting few comments around implementation of digital and transforming the landscape, just saying that digital technology, being implemented where it's helpful. So there's no point putting it in when it's of no help, or when actually what ultimately happens is that people stop recording or stop inputting data in an effective way. And you need to ensure that somebody does take overall ownership of the integration. So when you have a hybrid system, that someone is checking that all the information that you need is in the correct format, and then ultimately can come together when, for example, you have a safeguarding review or a GP round, wherever it may be, so that when you come to actually download the information, access the information, that it is all there. Next slide, please. So a summary, and it's picking up as well on what both Rishi and Mike have said around, so knowing your workforce, you need the system to work for you. So you need to know who the early adopters are going to be. You need to know who's going to be having issues and struggling, and you need to see what you can do to support them. Speak to other providers, see what they've done to support that 20% at the end who may have had difficulties. Go to information sessions like these, see if you can get any top tips from them, but also acknowledging that it's a continual process. So it may be that, let's start with 50%. I hope that it's not 50% for anyone, but 50% of your team just cannot get on board with implementing digital care records. But that, next time round, or when you launch the next module, or when you have the next part of the system that you are launching, that it'll be 40% and then 30%. It'll just continue to go down. Be realistic though. So what is important information that you cannot be missing? So for example, EMR, we had a nurse who just was not able to use EMR, so we didn't use it in the end, and it's only now that we are going to be launching EMR as well, and that's just being realistic of the workforce. You can't force people to suddenly become capable and have the ability to want to do it, especially if people, nurses in particular who have PINs. There's a real worry around medication, safe administration of medication. So be realistic about the workforce, and just continue to test and pilot, and know that failure is okay. It's all just part of it. Be transparent with the team about what's worked, what's not worked, what you could try, what maybe you just won't do for now, and see how it goes. And I've just left it there to say, find a hybrid system that works for you. Don't exclude hybrid systems. The most important thing is that you have effective record keeping. It does ultimately improve the health outcomes for the residents and the people that we serve. Thank you very much.
Fantastic. Thank you very much for that, Tay. Some really helpful insight there into some of the practical examples. I think knowing your workforce and being realistic about how you do things are some essentials there. And I think as well, it was really interesting what Tay was talking about, hybrid systems. In reality, the majority of care services, even though they are digital, there will be some elements that they will capture in a different way, again, to make it easier, to suit their environment, knowing their workforce, knowing their limits. Again, so don't be afraid to create your own hybrid, as Tay says, to suit your team. So that was really, really helpful. Thank you so much for that, Tay. So now, just to round things off, actually, we are fortunate to be joined by Nadra Ahmed, the chairman of the National Care Association. And Nadra's just going to say a few words to summarize, maybe to recap on some of the things that we've said today, and to give some of her own thoughts on technology and embedding that within the workflow.
Thank you.
Nadra, over to you.
Thank you so much, Rishi. Thank you. Well, I've learned loads. Thank you very much for this, and for presenting this on behalf of National Care Associations. Really, really helpful, because of course providers are looking at this all the time, and all of you have presented it in such a way that there's some really strong messages to take away. And I think that the thing about taking the team with you is so key in all of this, and all three of you touched on that consistently, but also about being realistic. This goal setting, I thought, for everybody watching this, hopefully they will know who their 20% who may never get it are, and that might be the challenge they have to look towards. And I think that point was made so strongly by both Mike and Ty, that I find I'm not great at tech. As Rishi knows, when he first showed me the system that he'd developed quite a while ago, it kind of blew me away, because I thought, well, that's great if it works. That's really, really good. And I wish I knew, that I could do it. But I think the way that this has been explained about taking people with you and understanding that some people may just lack the confidence and be overwhelmed by the introduction of something new, I think that really is key. And I kept hearing about the influencers, and I could just see it. As I was watching all three presentations, what I could actually see was you can visualize in a care setting how this would really help you. And the whole purpose of some of this is to be able to spend more time with the residents and less time writing things. And I think, that the example of Tina was amazing, because that shows that actually that is, it is conquerable, and it's not something that you can't that you have to shy away from. So this has been a really, I mean, it's I always learn something when I listen to Rishi, always, and I think I've learned today that there are steps. I think the bite-sized bit that was talked about is important. How you start it, how you introduce it, how you take people with you on it. On the journey, I think it is a journey, and how we can kind of develop that. The budgets was the bit that really got me, really, because I think it's one of the things people always talk about, well, can we afford to do it? And I think we do need to respond to some of those questions. And you pointed to some money that is available. And I'm sure Katie will have some thoughts of her own around how that can be supported, because this project is a really big project. And so don't dismiss it because you think you can't afford it, because actually the question might be, can you afford not to do it? Which is the point I think Rishi made, don't get left behind, even if you do it slowly. And I think I like the bit just at the end there about the hybrid kind of, work it through. There are lots of providers out there who offer these services. And I think it's important to recognize that you might need to see a couple of them until you get to the one that you really want to be working with. And it's that confidence of understanding that the person you're talking to is going to be able to help not only you and your organization, but your staff come through it, because they will be doing that out of hours exercise of supporting you when it all goes wrong. The other thing that really has gripped me is, what happens if you lose connectivity? And I think you kind of touched on that, Rishi, because that would be my biggest fear. I have to be honest, what happens if I lose it all? And that important question around that you also answered. So thank you. Thank you for that. Really powerful. All three of you. Thank you, Mike and Tay for their presentations, and Rishi for putting it together. And I'm really proud that, National Care Association was able to put that on with digital to support it. So thank you.
Thank you, Nadra. Thank you.
I don't think there are any questions. I can't see any, but.
Well, I think we have one question.
Oh, great.
We do have a question, and it relates to, this is something maybe I'll put to Mike and Tay to sort of give some of their thoughts, is that if you're currently totally paper-based, what is the very first thing you should do to start your digital journey? So I think one of the things that we all talked about was starting of daily notes. That's a nice way to introduce people to the system, to win the carers over who are maybe more tech savvy. And that's a great way to introduce the system. But Mike, Mike and Tay, do you have any thoughts on that? What would you say is that if you're totally paper-based, what's the first thing you should do to start the journey?
I think try and figure out where you're going. Where is it you want to get to at the end? I sort of got a little bit excited with the whole digital thing and kept adding things on. And as I say, in the end, actually, I hadn't thought enough about the infrastructure to support it. So I think you have to look at the two things hand in hand. At a practical level, once it's implemented, I do think the daily notes are a great way to start, because you can keep it really simple. How many daily notes have been added into the system, and a little chart which you can print straight off the system, so you're not actually doing any work, but everybody feels that they're part of it and everybody feels they're contributing. And I just think it's a really nice, simple way of people feeling they're making a success of it. But I think that's, before you get there, it's got to be, where do you want to get, and have I got the infrastructure in place? Get the infrastructure in place first, and actually that's often where the real expense can be.
Yeah, brilliant.
It's about also knowing your workforce and the current issues that you're having. So if I was going to launch again at Cambridge, the first thing that I'd probably do would be inputting in everybody's medical diagnosis and resident summary, which would be like a really helpful way for staff coming in to be able to just quickly get to know the resident. So we've got a paper like resident summary sheet, but we've recently just started actually remembering, because there are so many bits to all of your digital systems, the care plan, the medical diagnosis one, because we've got a lot of student nurses and student nursing associates at the moment who are with you for like a 10-week period. You just want to give them a quick snapshot as to who the residents are before they go out and about on the floor and when they're sitting in handover, for example. So again, knowing the workforce and what it is that you want the system to do for you and to support you with your, with your activities.
Yeah. I think as well, the example that you gave, Tay, about hybrid and about, your resident who you did decide that it was best to go onto a fluid chart on paper, for that benefit. I think deciding on the circumstances, the people around you, all of these things have got to have a bearing in those decisions and where you start and how you start. I think there's some really nice ways. The main thing is you don't want to stress your team out, especially when there's compliance issues, when there's compliance to be maintained as well. So keeping the stress levels down is really important for that buy-in and for embedding the tech in the first place. So,
but it can also help you think about how you work. So you can also set, for example, care routines to send an alert. Sorry, I know I'm telling you, Rishi, but to set an alert to say you've got to turn a resident every couple of hours, which we found that didn't work for us. It just didn't work for us, and the team were just ignoring it, and everybody kind of just thought, oh, it's for somebody else. So it made us think, well, what do we do about this? In handover, we just allocate a carer and the responsibility of that particular resident for that shift and say, right, it's for you to take that responsibility on for every 2 hours to turn that resident. So the digital record keeping, it shouldn't sit, separate to what you do. It should help inform what you do. It should be part of the conversation. It's like having an MDT with another partner there. It's meant to be fully integrated into what you do, and that's the only way that it will work, when it's integrated and it empowers the people and the users that are using it.
Yeah, fantastic, brilliant. Okay, there's a question for Mike here. Mike, you mentioned you also rolled out remote monitoring. Does this integrate with the care planning system that you use, or is it separate? If separate, how do you engage your staff to use both products without feeling it's duplicating work? That's from Kristin. Thank you, Kristin.
Yeah, and it's a really valid point. So when we introduced remote monitoring, it was actually across Havering as a whole. So it wasn't specific to my care homes. And initially for our care homes, it was a duplication of work. But one of the benefits, going back to an earlier slide, was working with a provider who is going to listen and work with you and adapt and develop their system that actually has those integration methods. So for instance, the provider we're working with is currently aligning the two systems, so it will automatically feed into our system, so it's only recorded once. So because we're a small company, you do have to be slightly patient in getting systems integrated, because we perhaps would do it a different way if we were managing it all ourselves. But I have to say, we're very fortunate that the provider we work with listens, engages, and recognises the benefits of integrating their systems.
Okay, well, Kristin says thank you. Fantastic. So we are now coming to the end of the session now. So as Katie's put in the group, if anyone wants to contact any of us, please get on to hello@digitalsocialcare.co.uk, and then your questions can be put across to us. We really hope that you've enjoyed the session today and found it useful. a massive thank you to Nadra as well for getting this together and for involving us to get us to be part of this. It's been really a really nice exercise for us as well. And yeah, good luck with everyone going digital, and good luck on that journey. I hope that the insight that we've given you today has been helpful, and look forward to seeing you all soon. Thank you very much. Thank you, Tay.
Thank you to all of you for the time and sharing your experiences. Thank you so much.
Thank you. Thanks, Tay. Thanks, Mike.
Thank you. Bye.
Katie and Claire, thank you. See you all later.